Tonight, a chilling glimpse inside the U.S. epicenter of COVID-19.
All the patients in this room, all the feet that you see, they all have COVID.
Speaking to the New York Times, Dr. Colleen Smith calls Elmhurst Hospital in Queens, New York, apocalyptic. It saw 13 deaths in 24 hours.
We had to get a refrigerated truck to store the bodies of patients who are dying.
She says the need for ventilators here is dire.
I don't have the support that I need, and even just the materials that I need physically to take care of my patients.
Outside, the patients began arriving here early this morning, police urging them to stand several feet apart. We had seen this in other countries. This is Queens, New York. Elmhurst has started transferring non-COVID-19 patients to other hospitals.
I don't know what's going to happen. I don't know.
From a distance, we spoke with Ignacio Ramirez, who started feeling symptoms on Sunday. He waited 5 hours in line today to get tested.
I have fever, a terrible headache. It doesn't stop. I feel very weak. It's horrible.
Our station WNBC got rare access inside another hospital in the Bronx. The ER is packed. Soon, this triage tent may be necessary.
Yes, it does affect the elderly much more, but we are seeing a lot of younger patients.
In New York State, the number of coronavirus cases is skyrocketing, now more than 37,000, a triple-digit spike in deaths in just one day. Dr. Craig Spencer is an ER doctor in Manhattan who years ago survived Ebola and now says the crisis is worse than it appears.
The disconnect between what you might be hearing at a press briefing and what I'm hearing at sign-outs every single day in the emergency department, that chasm couldn't be wider.
2 weeks ago, an assistant nursing manager at Mount Sinai West, Caius Kelly, tested positive for the virus. He died Tuesday night. Today, authorities said while the state may have spot issues with distribution of personal protective equipment, or PPE, it has enough for now.
We have enough PPE in stock for the immediate need, not past the immediate need.
Governor Andrew Cuomo says lack of ventilators is still an urgent problem, since the average COVID-19 patient on a ventilator stays there for 11 to 21 days. Doctors are now resorting to splitting the devices to help 2 patients at a time. Back at Elmhurst, Dr. Smith has a warning.
If this goes on for a month or 2 or 3 or 5 like it did in China, and we're already this strained, we don't have what we need.
And that's why she's speaking out now.
I don't really care if I get in trouble. People are dying.
Late today, New York City's mayor said that 40 more ventilators and dozens of extra workers have been sent here at Elmhurst. The state is now scouting new locations for more overflow hospitals.